Healthier Together, sponsored by Regents Blue Cross Blue Shield of Oregon.
The number of Americans living with Alzheimer's disease is growing and growing fast. 1 in 9 people 65 and older have Alzheimer's. That's 6.7 million Americans, and 69,000 of them are Oregonians. The new numbers come from the Alzheimer's Association's Facts and Figures report, an annual breakdown of how Alzheimer's is impacting our state and country. Lenny Steinberg is the program director for the Alzheimer's Association of Oregon and Southwest Washington.
That really helps us to focus and narrow our reach and who we need to be targeting and what we need to do as an association to hopefully find a cure.
The report offers a snapshot of where our country is when it comes to Alzheimer's. Almost 2/3 are women. Older Black Americans are twice as likely to have Alzheimer's or other forms of dementia than older white people. Many of the people who care for these folks are unpaid. And as our population continues to age, the need for more qualified care will only increase. The U.S. will have to nearly triple the number of geriatricians to effectively care for the number of people projected to have Alzheimer's in 2050.
Knowing that geriatric physicians are going to be necessary to be able to combat this disease. We know that it is going to be the #1 occupation needed in the next 10 years.
Another big takeaway from the report, 54% of people who have self-perceived difficulties with thinking and memory have not talked with their doctor about it. In fact, many doctors themselves are not starting the conversation about cognitive memory issues. So it's really important to do it yourself.
You could live a very full life with Alzheimer's or dementia, and it's all, dependent on your attitude and what you know about it and how prepared your family and loved ones are to help and assist. Now, the other thing that this report does is get that type of advocacy out in front of a lot of people. Right now, we are in the era of treatment.
The FDA has now approved 2 Alzheimer's drug treatments. It's the biggest breakthrough in nearly 20 years. But Steinberg says there's a problem.
We are now working because while they're FDA approved, CMS, so Medicare and Medicaid, have not approved them, and they are the only FDA-approved drugs that are not approved by CMS.
He says it's really important to get information like the Facts and Figures report into the hands of lawmakers.
So they can see that we really need to be focusing more on this area and get these drugs and medications approved and out to the masses, because right now you can only get them if you're in a clinical trial or if you're ready to spend a lot of money.
And no matter where you are in the journey, the Alzheimer's Association has resources to help. Education, support groups, and more. We have links to resources and information at kgw.com/healthiertogether.